My first platelet-rich fibrin session for hair regrowth at Rock Health.
Welcome to Rock Health Clinic. Perfect, yeah. I highly recommend iPRF. We also do PRP treatments as well.
Okay.
Yeah, follow me. So let's have a consultation. So we're just going to run through a consultation, make sure it's safe for you. We're going to have a look at your medical history, any allergies, and make sure it's suitable for you and what best care routine we can get for you. So okay, so looking at your hair follicles already coming out.
Yep.
So it will take time. It normally grows 1 centimeter a month. But with a combination treatment, we're looking to get your new full head, and it can take up to 6 months.
Because I've been using the finasteride minoxidil, I've been using that for about 2 months now.
Perfect. So it takes up to 6 months for your DHT levels to come right down where we want it, and then we have to maintain it. With iPRF, what it will do is angiogenesis, so make new blood vessels, and growth factors will activate your hair follicles, so more oxygen nutrients will go to your hair, making them thicker. And give you a best treatment plan. Because along with iPRF, we highly recommend minoxidil and finasteride as a combination to get the best result possible. But it has a pain threshold.
Exactly.
This is right here. So I use a vibration device and ice packs. There's lidocaine as well, but you'll be fine honestly. So welcome to Rock Health Clinic. Come take a seat.
Cool. So I have to sit down here, yeah?
So take a seat. That's it. So we're gonna go for the iPRF. PRP is really good, effective, but iPRF is 5 to 10 times more effective. The reason why it has 5 to 10 times more growth factors compared to PRP, and when we inject it under your scalp, it forms like a natural fibrin mesh. What that means is slowly breaks down over 2 weeks, slowly releasing the growth factors. So modified version, and you have small amount of stem cells. So that's going to give you the best growth. And of course, like we talked about, use it along finasteride and minoxidil to get the most powerful results.
So what's the difference between PRP and iPRF?
Fantastic question. So PRP is platelet-rich plasma, so it has an anticoagulant in there. What that means is it stops the blood from getting thick. So when we inject it into your scalp, it's a liquid form. It releases the growth factors up to 4 hours. With iPRF, it stands for Injectable Platelet-Rich Fibrin. It does not have any anticoagulant in there. So when we inject it under your scalp, it forms a natural fibrin mesh which breaks down over 2 weeks. So slowly releasing the growth factors, whereas PRP was over 4 hours. And not only that, iPRF has 5 to 10 times more growth factors compared to PRP, hence why it makes it far more potent and more stronger and better results. So lower your arm like this to the side. What did you drink today?
Yeah.
I drink a lot of water.
Yeah.
How much fish for me?
How much blood are you going to take out?
Oh, it's going to go for, normally to 10 ml is enough to cover the front of the head. I'm going to go for 2 bottles if that's okay with you.
Yeah, sure.
20 ml. Okay. Well, I'll fill the crown area, then one from the front. 20 ml, maybe a flash for me.
Yeah, that's good.
Okay, just make a little fist. Touch. So just keep your arms straight there.
Good.
We're on bottle number 2 now. Well done. Keep nice and still. You okay, yeah?
Yeah.
No, that's it. Just keep your arm nice and still. 1, 2, 3. Just follow. So now we've got your blood. It's nice, looking really good. We're going to put in a centrifuge and separate the blood to get the plasma out. So this is a centrifuge machine, and that's what's going to separate your blood and to get the blood plasma. So we're going to separate the plasma with this.
So Rizwan, how long have you been doing the PRP and the iPRF?
So I've been doing it for over a year now, and we moved on from not just hair and face. We're actually now using the same PRP, believe it or not, for rejuvenation, for arthritis, shoulder pain, and it works amazingly because you use your own immune system to do the healing. Your plasma is ready. So this is your red blood cells. That contains oxygen only, so we don't use that. This is your liquid gold, the blood plasma. Now this looks really nice and healthy. Now we can tell by looking at the color of this how good your results will be and how strong your plasma is.
Yeah.
And plus, if you have high cholesterol or if you've done active infection, I'll be able to see this. It'll become like a milky, cloudy color.
So what are my cholesterol levels?
I can't tell you cholesterol, but I can tell you it's not very high. It's in control, and your plasma looks very healthy. Now, normally, volume of this 1 tube is enough to cover the full head because it's high concentration, so we only need small amount per area. However, we're going to turbocharge your hair regrowth, so we're going to go for 2 tubes today. So, can I put this on there? 1, 2, 3. Just me drawing this up. Okay.
Oh, do you know with the fibrin, what's the difference between what you inject in with the PRF and the PRP? Will it look the same? Or how do we know it's the fibrin and not the platelets?
As in, so the platelets gel up, they form into a fibrin. From all the way from here, we're going to cover all this area, including the crown, all the way up to here. We're going to fill all this up with the plasma. So the pain will ease off because we use this vibration device. So when we're injecting, this is what you feel. Use the vibration device that confuses the nerves and eases the pain. So I want you to focus your mind on this vibration. Alright, so also you relax, and when the treatment's done, I'll wake you back up. This is trigger. Okay, so we're just going to put some antibacterial on to reduce any risk of infection, so make sure your scalp is nice and clear and prevents any infection.
Easier because I've shaved my head, just to hide the fact that I'm balding, to actually inject the PRF. Does it make it easier for you?
It's fine. I mean, for this treatment, you don't need to shave your hair or cut your hair, so you can leave your hair as you like. So it makes no difference. We can target both shaven and unshaven. If you prefer unshaven, you don't need to have a haircut or cut your hair. What really got me into the PRP journey was through my own journey. When I lost my hair. And I tried everything, transplant and everything else, all the supplements. It didn't work until I was skeptical about PRP. but I looked at the clinical studies and actually got it done myself, and I started regrowing my hair, and it worked perfectly. So now currently I had a hair transplant about 2 months ago.
Yeah.
Along with that, I'm doing iPRF every 3 weeks, and I'm also using, very importantly, finasteride minoxidil mix. This is the best, highest amount of minoxidil you can get, 10%. And finasteride is the most important component, because this is the only one that's clinically proven to reduce your DHT level and your testosterone converted into DHT. DHT attacks your hair follicles and moisturizes them, and is very high concentration in the crown area. This is why it's easier to regrow hair at the front and it's difficult on the crown area. Even with a hair transplant, survival chance is only 20%. So hence, anyone getting a hair transplant, before they get a transplant, 6 months before, I highly recommend use finasteride and minoxidil before they go for a transplant, because it takes up to 6 months to bring your DHT levels down. And then after the transplant, they need to use for good for 6 to 12 months to get the best results, and for the grafts to survive as well.
That's a really good point. So people, if they go for a transplant and they haven't pre-treated their hair with a DHT blocker, there's only a 20% chance that their follicle will survive?
That's correct. So that's why we see so many of our customers who had 1, 2, even 3 hair transplant. After a couple of years, they come and their hair have become really thin and fallen out. And there's a myth out there that hair transplant are permanent hair, and it's not. I could tell you, I've seen hundreds of customers here, who have to spend hundreds of pounds more after they've had a transplant to now regrow their lost transplanted hair. And the reason is they're not being diagnosed with a root cause problem, which is down to DHT. So it's very important to use finasteride to bring that DHT level, and highly recommend, if you're spending money on a transplant, 6 months before you have a transplant, start using the finasteride spray.
Is this combination, this hair loss combination, finasteride minoxidil, is there any particular brand that you're using or that you've had experience with?
For myself, I've ordered from Medical Mojo. They've got the foam, which I really like. It works really well, and I'll show you how nicely it comes out. You just apply a small amount and just apply it directly, and if the way it feels is lovely. So I use this for myself, and there's a spray version as well. So it comes in that form.
Oh, this is the liquid.
Yeah. So that's really good as well. So I normally give my customers both options. However, I use this for myself and customers, and when they combine with PRP and iPRF, right from day 1 of the treatment, I see massive improvement. Because normally these treatments, our hair normally grows an average 1 centimeter a month, but when you combine it with these treatments, it really accelerates the growth. And we have seen dozens of men who have got iPRF, PRP with us, use this, fantastic results. Because remember, you gotta bring the DHT down to get the best results.
So what about, I have a friend who's like, he won't use the finasteride and minoxidil, he thinks it's artificial. He uses like the organic oils, rosemary oil and things like that. So how do they compare, and will you get the same results of just using the organic oils as opposed to doing the PRF with the finasteride and minoxidil?
We do get that query quite often, because people don't want to use the minoxidil and finasteride because linked to some small amount of side effects, which is fine. So we obviously respect people's different opinions. So clinically, we have to look at the studies again. There is some evidence about black seed oil, when applied, can reduce small amount of DHT. And so we also have an option for black seed oil, which is 100% organic. So black seed oil is recommended if you have a DHT issue and you don't want to use finasteride. That's an alternative. Second option, if you don't want to use minoxidil, remember minoxidil increases blood flow to the hair. Next option is similar to that, is rosemary oil. Organic, it works well. However, the minoxidil that we normally issue or Medical Mojo has, that has 10%. The studies that have shown effectiveness of rosemary minoxidil, that compared to only 2% minoxidil.
Okay.
So it works, and we do recommend rosemary oil for our customers as well, along with the natural oils. So remember, you want to keep your scalp nice and moisturized. because the more moisturized it creates a nice healthy environment for the hair to grow. A moisturizer highly recommended is other things like coconut oil, castor oil, fantastic.
Yeah. Okay. And there's nothing more organic than your own blood.
100%. I mean, PRP and iPRF, 100% natural. There's nothing else added in there. We're using your body's healing system to repair and grow. So when you bang your arm and you cut yourself, what does the body do? It sends all the platelets to help heal, reduce inflammation, and heal. We're just harnessing that, but in a very concentrated manner and activated manner as well, and we inject it there to start the process.
Fantastic. So basically it's the body healing itself. So all these growth factors are already in the blood. So why isn't this happening? Why is, you know, my hair not growing automatically?
Fantastic question. The reason why that's not happening is we talked about DHT. What it does is shrinks the blood vessels. So what that deprives the amount of blood going all the way to the root of the hair. So lack of oxygen and nutrients are going, and platelets are going to the root of the hair to cause it to grow. And also what we're doing is by taking your plasma out, we are actually concentrating all the platelets together. So by putting a centrifuge, by separating, what happens is you get billions of platelets concentrated together. And not only that, the platelets look like actually like a circle. Mm-hmm. So when you centrifuge them, they grow like tentacles from there, meaning they're ready to activate and squeeze the 7 different growth factors that are inside the platelet itself. So now these platelets are activated, and when we inject it, so they are concentrating, active, ready to release the growth factors. That's what makes this more powerful.
So basically using the body to heal itself.
Yeah. That's the idea. So what we're doing now, we're injecting the blood plasma with high concentration of platelets. We're going about roughly 1 centimeter apart to cover the area. Ready? Right here. So we normally recommend for 24 hours keep your scalp nice and dry.
Okay.
Really helps. Some areas will be more sensitive than the other. Nice deep breathing. This. Just to show how much comes out from the needle. Can I just put chin down for me?
how far does the needle go into my head?
So we're currently using 4mm needle. So again, you don't need a very long needle to go far to the bottom of the root of the hair.
It doesn't feel painful at all. How often should I come back for this treatment?
So we recommend at least 3 to 4 sessions. To do one session every 4 weeks.
So I have 3 sessions, 4 weeks apart. How often do I need to repeat that to keep my hair?
So we recommend at least 3 to 4 sessions. You do one session every 4 weeks. Then after that, every 6 to 12 months, you need to do one maintenance treatment to maintain the results.
Yeah.
And unfortunately with hair loss, there's nothing that's permanent treatment. So there's nothing there that you do one treatment and give permanent results. And that includes hair transplant. When you start losing your hair, unfortunately you have to treat it and maintain it for a long time. The longer you have to maintain it, the longer you'll keep your hair. So you have to do, it's an ongoing long-term process.
iPRF and PRP versus hair transplants.
Okay.
Because I've seen a lot of people spend thousands and it doesn't look very impressive to me. So how do the results of PRP and iPRF compare with a hair transplant?
Good question. So it depends upon each individual's different case and depends what stage they are at the hair loss.
Yeah.
For example, somebody who's got hair loss and it's like a shiny hair, then I recommend hair transplant.
Yeah.
And after when you do a hair transplant on the day, I recommend get a PRP and iPRF.
Yeah.
This helps with the healing and survival of the graft. And 4 weeks after they had a hair transplant, start with the finasteride and minoxidil straight away after that. Somebody who's, for example, the crown is thinning and the hair are thinning, the follicles are live, there's blood flow going to there. So they should rather go for a transplant option, which is expensive and takes 18 to 16 months for the full results. I recommend use finasteride and minoxidil straight away and get PRP or IPF every 4 weeks. You need at least 3 to 4 sessions to get the best results.
So what's your prognosis here?
Yeah, so with yourself, because you got a lot of live follicles, you can see here, so your blood vessels are live, there's oxygen nutrients going to there. So that's, I highly recommend, your best combination would be iPRF treatment, 3 to 4 treatments, so 1 treatment every 4 weeks, and straight away use finasteride minoxidil every day, ideally twice a day, morning and night.
Fantastic. So I just need to come to Digbeth and I don't have to go to Turkey then?
No need to go to Turkey, we're right here in Birmingham City Centre.
Oh, okay. Do I need to take any time off work now, or and when could I wash my hair? 24 hours, you said?
So the main thing now is to keep your hair nice and dry, to let the pores heal. And in terms of that, there's no downtime with this, so you don't need to take any time off work.
Yep.
As you can see, we injected the whole head, but you can't even tell that we've done it.
I haven't got massive holes in my head.
Not at all. Have a look in the mirror. It looks perfect. You could go to a wedding after this. Nobody will know that you actually had the treatment.
Like, have you seen that film as well, Pinhead? I'm not going to look like Pinhead from Hellraiser.
Not at all. Perfectly fine. You go to a wedding or date after this. Not a problem.
And it's not like, you know, the guys that have the hair transplant, they've got all the bandages. So this is, I'm fine to go out. No one's going to stare at me.
No one's going to stare at you. There's no bandages, there's no plasters. It's all healed or minimum invasive. That's the beauty of it. Natural, minimum invasive.
And if anything, will I feel any itchiness, or how will I know if there's like maybe an infection? What should I look out for?
Signs of infection, where you look for redness, or if it gets hot, where we injected you, and inflammation builds up, then give us a message. But they should be nicely healed now. All your pores are nicely clean. We had antibacterial, so risk of infection is bare minimum.
And when can I start? Can I apply my finasteride minoxidil tomorrow, or shall I wait a day?
We normally recommend wait 24 hours before you apply anything onto your head. Let it heal, then after that you can continue. And along with that, we highly recommend to use a derma roller, which is 1.5mm in length.
Yeah.
To use that once a week after a shower when your skin is nice and soft. The reason being, if you were to use the spray, it's normally around about 20% absorbed down to your roots. when you use a dermal roller, it increases absorption up to 80%, making it far more significant absorption and effect as well.
Fantastic.
Perfect. Any more questions?
No, I think you've covered
So
it.
this is your post-treatment advice. Everything I explained to you, we've written it down.
Yep.
Any issues, just message us tomorrow.
Awesome. Thanks, bro.
Thank you very much.
Can't see anything. Did you actually do anything? No, sir.
Right, Shaz, how's it going?
Yeah, it's awesome. It was, came here, had the iPRF. Everything was super professional, everything, it was painless. And it was over very quickly, so I'm super confident in the whole process and the procedure, and I can't wait for the results. And I'm going to be back in 4 weeks, so keep you posted on the progress of my hair. But yeah, it was, if you're losing hair, I think the iPRF combined with the finasteride and minoxidil, that's the way to go. Riz, I've noticed this. You've been nominated for the Entrepreneur of the Year. Have you won it?
Fingers crossed. So 30th of November at NEC will be the final announcement. So I'm a finalist for Entrepreneur of the Year. Included in the category is Ben Francis, CEO of Gym Shop. So all the whole high profile. So 30th of November at NEC, I will find out. And I was nominated for my services for PRP and iPRF for specializing in that. And we've got hundreds of successful stories, life-changing one. And what's really important, I realized in my community pharmacy, especially during Mental Health Awareness Week, I was really surprised in terms of how many men, how it affects them mentally when they go through hair loss. It really affects, not many people realize this, it really affects their self-confidence, it affects their relationship, the social circles. When they're going out with their friends, they don't feel confident, so they withdraw themselves. Going out with family and family events, and even they affected their business life as well. And when I've turned it around, when they've grown their hair, they got the confidence back. They're willing to now socialize. It's really helped with their depression and give them their self-confidence. And honestly, it's been life-changing, seeing a lot of men turning their lives around.
Awesome. Hopefully it'll do the same to me. But good luck on the 30th.
Thanks,
awesome,
man.
Riz.
Thanks, man.
So, if you're losing your hair, just come here. No need to go Turkey. What's here?
Yeah, this is like a virtual room, so we quite everything here. You can do submissions and events here as well. So yeah, we quite everything, full experience here.
Yeah, so if you want iPRF or PRP, come here, you get this amazing immersive experience as well. Thanks very much.
So after 6 months I'll be able to come here. If you grow the hair, please don't come down here.
Will I get a discount?
I'm going to go, I'll go for the